But if you need an antibiotic and you need it, and you're talking to your doctor and they're a good doctor and they say, you need this, you have pneumonia, you need to take that antibiotic. So it's life-saving on the one hand and killing people on the other. Like, how do we fix this? Because you have to take care of the people who end up in harm's way because of the overuse of what I will call run-of-the-mill antibiotic prescriptions that are happening on every street corner in America. It's like there's an opiate epidemic. There's also an antibiotic epidemic.
Yeah.
So what do you think's the answer?
I think education is power, and education not only for the patients, but also the clinicians. Urgent care providers, they aren't infectious disease trained. And when we all became in the healthcare profession, we all signed an oath that we would protect all of society, and giving antibiotics away is not a way to do that, but education is a way to do that. So what I have in my setting, my practice setting, is I have a commitment poster that I've signed that I will only give an antibiotic if you really need that antibiotic. And it gives pamphlet, there's also a brochure and pamphlet for the patient to read in that waiting room so that they're educated in that free time. So short answer, education. Education to the patient, education for the provider, for them to really want to learn about the negative consequences of giving an antibiotic.
You know, Travis, my two kids, as you know, are both physicians and went to medical school recently. And I know for a fact that medical school now is driving it into their students that you prescribe antibiotics only when you've made a diagnosis, you've identified a specific organism that's sensitive to this antibiotic. That's the only indication. I'm not sure why these doctors are changing their thinking once they get out into private practice.
Sometimes it's because, like Leslie said, what she found, people...
The patients aren't going to be happy. They're not going to get the rating.
Right, and they want a good review on the internet.
So it's incumbent upon all of us as healthcare providers, as patients, and I don't think anyone here is trying to undermine the importance of antibiotics or having easy access to care. But just be aware when it comes to your own family and ask, is this antibiotic necessary? We did invite the Urgent Care Association trade group to join today's discussion, but they declined and sent us a long statement instead that includes the following. The Urgent Care Association and our members are committed to being part of the solution to ensure appropriate antibiotic prescribing. They then describe at length how they are taking part in an antibiotic stewardship initiative. They conclude by saying, we will continue to focus on responsible antibiotic stewardship and appreciate the commitment our members have made to responsible antibiotic prescribing. And in defense to that statement, it's incumbent upon the individual practitioner at every urgent care, at every clinic, at every emergency department. It's incumbent upon them. I mean, it's the individual prescriber who needs to make better decisions. The entire statement, we're going to have that on our website, thedoctorstv.com. Dr. Sklar, thank you so much for being a part of today's show.